Hello and welcome to this poster presentation called Mina Nindamowin, Feeling Good, Thinking Good. MInD, Aging in Place for First Nations Communities, a community-based approach to supporting older Indigenous people with dementia. My name is Sebastian Lefebvre and I am the Research and Development Coordinator at Mamwesing North Shore Community Health Services, and I'm joined today by Michael Ann McLean, the Research Projects Coordinator at Nindamowin Health Centre. I would first like to acknowledge the traditional lands and communities involved in our work. This poster presentation is being recorded in the city of Greater Sudbury on the traditional lands of the Atikamekw and Anishinaabe, and part of the city is found on the traditional lands of the Wanapitei First Nation. I would like to acknowledge the First Nations communities on Manitoulin Island, which we worked with Wikwemekong Unceded Territory, Chiging First Nation, and Cheshagwaning First Nation, and also the communities on the North Shore, Atikamekw Anishinaabe First Nation, Sagamok Anishinaabe First Nation, Serpent River First Nation, Mississauga First Nation, Thessalon First Nation, Gun River First Nation, and Batchewana First Nation. Disclosure, we have no relationships with for-profit or not-for-profit organizations, and this research project was made possible through a grant from the Canadian Institutes for Health Research. The Mina Nindamowin project seeks to partner with communities to identify services, resources, and support to address the unmet needs of persons living with or at risk of developing dementia, and to support their families, communities, and caregivers to ultimately reduce caregiver burden.
There are three research questions that we wanted to answer during this project, and the first one is, what are the needs faced by Anishinaabe adults age 45 plus living with dementia and their caregivers and their families? The second question, what are the contextual factors that contribute to the health issues and barriers to care for Anishinaabe adults age 45 plus living with dementia and their caregivers? The third question is, what are the services, resources, and supports that are currently offered to Anishinaabe adults age 45 plus with dementia and their caregivers on Manitoulin Island, the North Shore, and the Sudbury-Algoma District?
On this project, we were interested in working with caregivers of people that were over the age of 45 living with cognitive decline. And for this project, we worked with our community partners at Atikamekw and Anishinaabe First Nation and Chiging First Nation.
For the data gathering, the data for questions 1 and 2 was gathered through 10 one-on-one interviews with caregivers of community members who are currently living with cognitive decline. The question set was developed and guided by our steering committees. The interview questions asked our community members about their living experiences in caring for their loved ones living with cognitive decline, accessing care, and the impact of caregiving on their lives. The data for question 3 was gathered through an environmental scan, which assessed resources and services related to dementia care in Northern Ontario.
So for results, caregivers in the study had a diverse relationship with their care recipient, spanning generations and ranging in age from their early 60s to mid-70s. The duration of caregiving varied from 1 to 7 years. Motivations for caregiving included intrinsic factors such as feeling good and happy to help, as well as teachings about roles and responsibilities and commitment to family values. Many caregivers were unaware of their loved one's dementia until later stages. Caregiving activities encompass a wide range from spending time together to assisting with daily living tasks. And caregivers face numerous challenges, including mental, emotional, physical, and spiritual difficulties, compounded by the progression of dementia symptoms. Despite these challenges, caregivers found fulfillment in their role and recognized the importance of self-care and seeking support. Recommendations for care included improving in-home medical services, providing social supports and respite care, enhancing caregiver training, addressing resources needs, and establishing community-based care facilities. Caregivers also reflected on personal growth, increased empathy, and the significance of traditional teachings in coping with caregiving challenges. The environmental scan was targeting 41 organizations encompassing healthcare centers, hospitals, dementia and Alzheimer's-specific organizations, and Indigenous communities along the North Shore and Manitoulin Island. The scan focused on evaluating the ease of access and availability of these services to First Nations communities, as well as determining the methods for accessing them. We examined whether these services were culturally safe and if any Indigenous-specific services were provided. Moving forward, we aim to develop a distribution method to ensure that community members have easy access to all the gathered information.
We would like to acknowledge all the people who have worked or provided any help and support on this project. The success of the project would not have been possible without everyone's efforts. We would also like to thank all the communities that have welcomed us for our many presentations. We always appreciate the time given to us to engage with you.
Thank you so much for joining us in this posted presentation called Mina Nindamowin, Feeling Good, Thinking Good. If you have any questions or would like to discuss this project, feel free to reach out to me through email at sebastian.lefebvre@nimanoia.ca. That's sebastian.lefebvre@nmnoeyaa.ca. Thank you so much and have a great day. Miigwech.